One Devon is a completely new opportunity for us to rethink around the individual's needs.
It's a partnership between the NHS, the local authorities, the councils, and between the voluntary, community and social enterprise sector.
But also, really importantly, the voice of people who use services. That's really key.
Well, our mission is to make sure that everyone in Devon has equal chances to lead long, happy and healthy lives. And my vision is that we'll get on top of some of the terrible backlogs people are facing. Long waits, for example, people are experiencing in our emergency services, but also to make sure that services feel much more joined up around them and much more accessible.
My vision for health and care in Devon is bringing together all the resources, not just of the statutory services of health and care, but of communities, of the local authorities, of housing, bringing them together with one aim, which is to move to a wellbeing agenda.
I want people to have healthy and happy lives, and I recognise that health and care services have got an important role in enabling people to have the lives that they want.
There are huge challenges across health and care, as anybody who uses services will know. That's not just about the delays in accessing care, but the unequal access to care, particularly between those who need treatment for physical and mental health conditions, for example.
So at the moment we have a lot of duplication across our services, and often we also have systems that don't talk to each other. What we're aiming to do is ensure that we have a single system, which means that patients or people don't have to keep telling their story more than once.
We want to see the services that people receive start to feel much more joined up, and so that we see all parts of the system working much more closely together, so that we don't see health in one corner, social care in another, the work of the voluntary sector over here. We want to see all of that joined up, but most importantly that it joins up in ways that make a difference to the people who use our services.
I hope to achieve that by focusing on the needs of people and involving them in choosing what services make sense for them, we will support people to stay healthier for longer and make it easier for people to access care when they need it and speed their recovery from any illnesses they suffer from.
It's absolutely crucial that patients are involved. That's patients, it's carers, and there are many, many thousands of family carers that are actually out there.
We need to take into consideration the views of the population and of our patients, what their needs are and what their views are on the current provision and how they see it going forward.
They're seeing it day in, day out, and so listening and hearing what they have to say is absolutely essential, and then involving them in the change.
So people in our communities and our staff, they're the experts in their care. They know what they want, they know what they need, and our job is to listen to people, to respond to people, and then co-design services that meet their needs. And we need to do that in a way that respects the diversity of our communities.
What we do is we do a lot of work with patients or people who care for them, their families, friends, whoever they choose to have as supporters, and we design services with them or responses with them. And we know, and we can see the evidence, that if we do that, our services are better and people find them more beneficial.
So we have got some real examples of what's happening in the here and now about collaborative work, and that does include the vaccination programme, which has been a massive partnership, not just across the health system but across the voluntary sector and also working with our communities.
We've got a really long history of working with partners, whether it's in the voluntary sector, local providers, the care home sector, domiciliary care sector. We've worked with social care and they're formal partners of ours. So I think we've got a really strong history of delivering care together in Torbay and South Devon, which I'm keen that we build on.
One of our main partners is Livewell, who are the mental health and community provider for Plymouth, and we do a lot of joint work with them, but some of the examples are we've developed a community mental health framework together, and we're all implementing that at the moment in a consistent way across Plymouth, Devon, Torbay.
So here in Exeter, where I'm standing at the minute, we have the Nightingale Hospital, which was a collaborative effort by all of the health organisations in Devon to meet the needs of those people during the pandemic, which has then transformed, as we're coming out of the acute phase of the COVID pandemic itself, into a facility that can offer care for patients who need orthopaedic operations or eye operations, again through a collaborative effort, which is exactly the sort of thing that we want to see more of.
The impact of when we do this well is that people will live longer, healthier and more fulfilling lives.
I'm really excited about the future because I think we've got a breadth of skill, capability and innovation in Devon, and if we take all of that learning and bring that together for the population of Devon, we can really improve people's experience of health, improve their life experience and also improve outcomes.
I think the most exciting thing is the opportunity genuinely to work across health, social care and our voluntary sector and with community groups, and to be working in collaboration rather than in competition. And ultimately this is all about the people we serve. So what gets us out of bed in the morning is providing better care, and that's quite simply how I think we should be judged.